Hi there, this is Nick Casamia, and I'm here with Nurse Tim at Magnet.
At Magnet Clinic in San Francisco.
Do you love it here?
I love it here. We do great work.
Okay, so before we could talk about PrEP and PEP in some capacity, what does Magnet do?
Magnet is part of the San Francisco AIDS Foundation, and we're a gay men's sexual health clinic. We serve men who have sex with men, primarily gay men, bi men, trans men who live in the community and in the greater Bay Area.
And is it anonymous? Is it a not-for-profit?
It's a not-for-profit. San Francisco AIDS Foundation is non-for-profit. Magnet's non-for-profit. We get funding from the city and state of California, City of San Francisco, County of San Francisco, and the federal government through the San Francisco AIDS, not AIDS Foundation, but the Office of AIDS here in San Francisco. Okay. We are a very special clinic. We serve men who have sex with men and screen them for gonorrhea, chlamydia, syphilis, and HIV. Okay,
which leads me to ask you about two forms of, this PEP and this PrEP. There are distinctions, correct?
Right.
Could we talk about what the distinctions are, first of all?
Well, PrEP is before, and PEP is after. We look at it as a risk exposure here. Someone has had a risk exposure to HIV. PEP comes after the exposure, and the research is still a little bit out on that, on the effectiveness of it. PrEP, on the other hand, I look at it with my patients as another tool in the arsenal to help prevent HIV infection. It's something that is taken before there's an exposure to HIV.
Okay, so let me ask you this in regards to PrEP specifically. When it was first announced, it was heralded as the new condom. What is your take of it?
Well, I have my personal beliefs about it, but as I've read more about PrEP, I'm beginning to believe more and more that it's another one of the effective tools that individuals can use in their prevention program for whatever's good for that person. We know for fact that some men don't and will not use condoms when they're having unprotected sex. Okay, I would much prefer to have someone on PrEP who would be using PrEP as a method to prevent HIV infection rather than nothing at all. And again, how I usually describe this with my patients is this is a tool to use in the arsenal of things that we have available to you to help you prevent from getting HIV. Patients that we have seen who are on it tend to like it. Some of the side effects can include headaches. Usually headaches, wild, vivid dreams, and diarrhea are kind of the big side effects that some of our patients who have come in on PrEP report. But overall, it seems to be generally tolerated pretty well.
So let's backtrack a little bit. The struggle with HIV has been around for more than 3 decades now. What are some current stats?
Current statistics, and I can only speak for this clinic here, but we're here in the heart of San Francisco, and we tend to kind of set the trends for the rest of the country. Our average age here at Magnet of newly diagnosed HIV positives is in gay men under the age of 25. Now, that's a horrible statistic if you're just putting that out there. But I think, although the research doesn't support why, there's a lot of theories out there. One being 25 years ago, these gentlemen weren't even around, so they didn't live through that period when HIV was seen as a terminal diagnosis and then you died. The other thing, there's that whole maturity thing that goes on in growth and development when I'm still invincible. When I'm 20 years old, nothing's going to harm me. And then I think also the other thing is just the accessibility of healthcare or being able to go to a place like Magnet and talk about your sex behaviors and what puts you at risk. We're very unique, and that's why we see close to 15,000 people a year. We don't have magnets across the bridge in Oakland or out in Marin or out in the valley here in California. But healthcare is evolving, and it's our goal to help spread our message that gay men's sexual health is important, and it does it does work.
So in regards to condom usage, a lot of stats seem to vary in regards to the usage of actual condoms with men having sex with men.
Right.
What is your experience with those stats?
If you go by CDC guidelines, CDC still recommends that gay men.
CDC?
The Centers for Disease Control, federal government in Atlanta, Georgia. They still recommend that gay men use condoms for oral sex. I don't know too many men who use condoms for oral sex. However, it has been shown condom usage with either topping or bottoming with anal sex is an effective way to prevent the spread of HIV and other sexually transmitted infections. However, you've got to look at the reality of it. If condoms work for the individual, wonderful. That's a great tool. If condoms don't work for that individual, PrEP is an excellent tool to use with or without condoms. You know, Dr. Grant, who you are going to be meeting with tomorrow, spoke here at Magnet not too long ago, and he said the majority of people go out and they are planning to have sex. So what we do here at Magnet is kind of have a discussion with our patients about what are they doing when they're planning for sex. Are they using condoms? Do they take condoms with them? Do they get so drunk or party so hard that they forget completely about it? Well, there is a small minority of people who do things like that, then they don't remember, or alcohol impedes their thinking. So we're not here to judge anybody, but PrEP is another alternative for them to use if they're not going to be using condoms, because you can be on PrEP for weeks and forget to use condom one time. It still can save you from getting an HIV infection.
I'm curious because you just said a minority of people say that they, don't use condoms. Is it small?
The reality, probably not.
Yeah.
Now you're going to be meeting with my boss here in a little while. He'll probably tell you there are people that will absolutely swear against condom usage. There are people who completely believe in it. I was around 30 years ago during the HIV epidemic. I chose to use condoms. I'm still not infected.
But I'm not going to ask about your personal life. But
It's okay.
No, but do people always use condoms? I think
no, they don't.
That's the reality, right?
And the reality
people slip
is
sometimes.
People slip.
Condoms break.
Condoms
people
break.
don't know. I've had
condoms come off. Yep. And that's the reality. I'm not a government official to say you have to use condoms all the time. It's not what we do here. We look at what puts people at risks and then look at alternatives to say what would be the best thing for you.
Yeah. So why do you think, given what we were just talking about, how PrEP is a major breakthrough?
It is.
Why is it so mired in controversy then?
Boy, that's a hot potato to hold on to. I think you could look at it that PrEP could be a financial perk for some drug companies, because if you're buying it, it's not cheap. The last I heard, it was between $800 and $1,200 a month to be on that. It's still, in the bigger picture, cheaper than trying to manage an HIV infection for 40 years. But in America, we tend to get really focused on the dollars and cents of things. The other thing, it can't be viewed, I don't believe, as it's the cure-all or the fix-all. Again, that's not our messaging here. But there are some healthcare providers that think if they're taking a pill every day, they're never going to use condoms. And I don't necessarily agree with that. Again, we look at it as I'm giving my clients or my patients a toolbox. They can use what's ever in there for that.
Do you think some of the, maybe not backlash, but criticism over PrEP is that it sort of creates this atmosphere of, specifically though PrEP is being used now with women, I understand with case studies, but it creates this environment of sexual promiscuity. It allows people to perhaps be,
right,
more sexually adventurous than not?
Well, we're in San Francisco. We already know just from the data that we keep here that we live in a very sexually active community. And that's great. I'm glad people are having sex. What Dr. Grant's research that he shared with us shows that people who are actually on PrEP over time tend to decrease their risk behavior. And especially here in our clinic, we deal with a very well-educated population. So you look at it, the more education you have and the more tools at your disposal to protect you from something, in the long run, the less likely you're going to be promiscuous or doing extremely risky behavior.
What is PrEP's success rate?
Well, it depends on who you talk to. Right off the top of my head, I believe Dr. Grant's research showed about 80 to 90% effectiveness. Mm-hmm. Now that was Dr. Grant. I will be very honest with you. I don't know all of the data on that. Steve will, though.
Yeah. Okay. But as a nurse who deals with specifically with men who have sex with men,
right?
Do you encourage them to explore this option? I mean, can you prescribe it?
We don't prescribe PrEP here at Magnet.
Why not?
I think it's because of the way we're set up funding. In the city of San Francisco, and especially the clients that we have here at Magnet, a large portion of our population are insured and have a primary care provider. Mm-hmm. They come here for their sexual health needs because they may not be comfortable talking to their doctor about what they're doing in the bedroom. Because of the insurance component, and they have, insurance and relatively low co-payments, they can get a prescription through their physician, or we also help network with them to change physicians if they don't feel comfortable talking about what their needs are, like a gay-friendly doctor or a gay physician here in San Francisco.
See, for me, it sounds like a really great invention, a really great creation, a great tool for fighting HIV.
And again, I agree with you, but it is a tool. It is not the end-all, be-all answer to preventing HIV, but it's better than what we had even 10 years ago.
But wasn't the birth control also, at first people were like...
Well, of course, birth control was, you could look at PrEP as gay men's birth control, if you wanted to take that approach, and I've heard it referred to as that. If you were my patient and I knew you were out, and for the most part, 80 to 90% of the time you were playing safe when you went out to bars, but I knew 10 to 20% of the time you had a couple too many cocktails, and when that happened, you ended up in a person's bed that you didn't know, and you didn't have the conversation about their serostatus. I would still feel more comfortable knowing you were on PrEP and you used 80% of the time condoms in association with PrEP. That 10 to 20% of the time that you didn't use condoms, your success rate for not contracting HIV still is better.
As a nurse here, and we're in the Castro, where gay men come in all the time and inquire and ask you. How many people ask you about PrEP?
On average, it kind of ebbs and flows, but on average, I would say between 5 and 7 patients a week, and we're a 5-day-a-week clinic. And again, out of that 5 to 7, I would say at least 80% of them have healthcare insurance. They're coming here to get the information first, because this is what we do. We are a sexual health clinic. So we kind of are at the cutting edge, and with the San Francisco AIDS Foundation, we're kind of like the resource for the rest of the community to get information about PrEP.
Interesting. So do you wish you could prescribe PrEP?
I'm not saying it's completely out of the question. Right now, the good news is, like I shared with you, we're building a brand new clinic. Right now in this clinic, I'm seeing roughly 14 to 15,000 patients a year in 3 clinic rooms. The thing is, I just don't want to give you a prescription for a drug and not have the capacity to do adequate follow-up with you. Because you do have to keep track of other body functions, because these drugs can have side effects. So I would almost bet, if I were a betting man in Tahoe, within the next 3 to 5 years, that'll be an option for us to be able to provide services for PrEP.
That's great.
I think so too.
That's great. Thank you.
Oh, you're very welcome.